Hello, everybody. Welcome to the latest JACC author interview episode. I'm Mitsuaki Sawano, Executive Associate Editor at JACC. And today we are joined by our wonderful guest, Dr. Mats Lassen from Copenhagen University Hospital and the University of Copenhagen in Denmark. Dr. Lassen is the lead author of the JACC brief report titled Respiratory Syncytial Virus, also known as RSV, and Incidence of Cardiovascular Events, a nationwide self-controlled case series analysis, which is being presented at the ACC conference in Chicago and has been simultaneously published in JACC. Dr. Lassen, thank you for joining us today. And to start, could you introduce yourself and share an overview of your study?
Of course. Thank you for the kind introduction. As mentioned, my name is Mats Lassen, and I'm a medical doctor currently enrolled in a PhD program at the Center for Translational Cardiology and Pragmatic Randomized Trial at the University of Copenhagen. And in this present study, we sought to assess the temporal relationship between acute RSV infection and incidence of cardiovascular events using nationwide RSV test data from all of Denmark from the 2022-2023 winter season. And we did this because prior studies of both flu and COVID-19 had shown that there was an increased incidence of severe cardiovascular events such as ischemic stroke following acute infection. So we sought to assess this in RSV test data as well.
Thank you for the wonderful description of your study. So I do have a couple of questions. So why is it important to study the cardiovascular events following respiratory infections like RSV? And what broader implications does this research have for public health?
Thank you for the question. I think in general, it's important for clinicians taking care of these patients who are often hospitalized to know that there could be an increased incidence of severe cardiovascular events. The data we have used in this study is from elderly patients who then test positive for RSV, and they have a higher comorbidity burden maybe than the general population. They are often tested as part of routine clinical care in the ER when they present with the respiratory infection symptoms, and we hope that showing that these patients are also at an increased risk of cardiovascular events, that it will help guide both preventive management of these patients, where when they're in hospital, they may often not be at a cardiology ward. So hopefully this could sort of just contribute to the awareness that they are at risk of cardiovascular events. And then hopefully such data as these and from other studies may also help inform on RSV immunization strategies now that we have RSV vaccines for the elderly population.
That's a great point, Dr. Lassen. We, or many of us as cardiologists, are not so savvy in terms of like viral infection or any type of infection outside of infectious endocarditis. So I think this is a study that brings that to attention to cardiologists. And since many of the RSV vaccines are made available in many countries, this is also good timing, opportunity to let people know that these vaccines may work in order to prevent these cardiovascular events. All right, so maybe we can go into a little bit of the details, the methods. So can you tell me about the nature of the nationwide Danish registry that you use for this analysis?
Good point. And so in Denmark, we have we have a universal healthcare system. So it's the government that is the provider, and all Danish citizens, when they are born, are assigned a unique sort of social security number, but like a unique registration number that also if you immigrate to Denmark, and this makes it possible to do data linkage, complete data linkage across all registries, because this person number is unique to the individual. And we then have these national registries that are used for administrative purposes, for billing, and every time a Danish citizen is admitted to the hospital or just has any kind of an ambulatory visit or have a microbiology test performed, it is registered in these electronic registries that are then linked on this unique person number. And this makes it possible to do these nationwide studies where we, for an entire season, can use all test data on all citizens in a study. And it gives a very comprehensive study design where even though Denmark is a relatively small country, it is all citizens then can contribute to the data pool.
Thank you, Dr. Lassen. And that's why we love this article. It's the comprehensiveness of the data set itself that captures nearly the entire nation. And so that's the beauty of this analysis that the other readers should also be thankful about. The third question I have would be, your study found a significant increase in ischemic stroke and heart failure hospitalizations following an acute RSV infection. Can you elaborate on these findings and their clinical significance?
Yeah, of course. So yes, in our study, we found that the incidence of both heart failure and ischemic stroke were 4 to 8 times higher during the 14 days after testing positive for RSV. So that's what we term the acute phase of the infection compared to the control period. That is all the time outside of these 14 days. And we also assessed a broader endpoint of any cardiovascular event causing a hospitalization and found that the incidence was elevated by a factor 6. So that gave sort of a robustness to our results. And it's important in this study to remember that individuals who undergo testing for RSV as part of routine clinical care, that's a certain type of individual. As we talked briefly about before, this is national test data from normal surveillance data. So these tests are performed as part of routine clinical care. So these are elderly patients, typically with a more substantial comorbidity burden than untested individuals, and they present at the hospital most often with respiratory infection symptoms, and that's where they are tested, or at their primary care physician. But they present with symptoms of disease that causes them to have a test performed. So we do not propose that the risk of severe cardiovascular events is elevated to this magnitude for all individuals who happen to have an RSV infection during a season, as most RSV cases are very mild and never tested for. But for physicians who need to care for these patients, they are seen and admitted to the hospitals. And if they are admitted with an RSV that is so severe that they require hospitalization for it, then it's important to know that they are at quite a high increased risk of having a severe cardiovascular event within a relatively short time period after testing positive. So we hope that this awareness of the risk could potentially help with preventive measures and more diagnostic testing of these patients.
Wonderful. And given your results, how should healthcare providers adjust their approach to managing older adults during RSV season? Should cardiovascular risk be more actively monitored in these patients?
That's a good question. Well, I think there's multiple layers to this. One is, how should these patients be managed when they are hospitalized? Then yes, we hope this could create some awareness and maybe just people who didn't know that there are elevated risks of cardiovascular events following these types of respiratory virus illnesses is just good to have out there that it may be that the bar for ordering a diagnostic test with cardiobiomarkers or an echo is lower if you know that they are actually at an increased risk. The other layer is that now that RSV vaccines are available, this sort of data may help to figure out which groups should maybe be prioritized. And it will be very important in the future to figure out if the vaccines also lowers the risk of cardiovascular complications in these patients. Because then it may be that groups of elderly individuals who are at high risk of cardiovascular complications should be prioritized in RSV immunization strategies.
Great. And what are the next steps for research in this field? Should RSV vaccine trials consider including cardiovascular outcomes to assess potential protective benefits? Are you already into that field? Maybe you can also mention the trial that you may be also designing.
Yeah, thank you for the segue. The phase 3 trials of the RSV vaccines, they were able to show that the RSV vaccines we have now are effective against RSV infection and especially lower respiratory tract disease with RSV, but they were not powered for harder hospitalization endpoints. When you have vaccine trials, the sample size needed to have adequate power for these types of endpoints is just very large. So there's definitely a need for that. In the group where I am in Copenhagen, we run these large pragmatic vaccine trials, and we are right now running this season a trial with one of the RSV vaccines that is powered for hospitalization endpoints, cardiorespiratory hospitalizations. So there is definitely a need to show that they decrease hospitalization, and it will be very interesting to see if it's also cardiac hospitalizations and not just respiratory tract diseases, because that could really influence how we go about using these vaccines.
Yeah, happy to see those results when they are made available.
Thank you.
Dr. Lassen. Yeah, Dr. Lassen, thank you for sharing your insights today. Your study highlights the significant cardiovascular risks associated with RSV infections, particularly in older adults, and underscores the need for an increased awareness and proactive management during RSV season. The potential implications for vaccine trials and future research in this field are particularly thought-provoking. And for our listeners, you can find Dr. Lassen's full study, Respiratory Syncytial Virus and Incidence of Cardiovascular Events, a nationwide self-controlled case series analysis published in JACC and presented at the ACC conference in Chicago. Dr. Lassen will also be there in Chicago. And Dr. Lassen, thank you again for your time and for contributing this important research to the field. We look forward to following your future work. And lastly, to our audience, thank you for listening to this JACC author interview. Stay tuned for more discussions on cutting-edge cardiovascular research. Until next time.